Welcome to ILTV's Insider. I'm Aaron Porras, and today, Israel's second nationwide coronavirus lockdown is underway, and it's wreaking havoc across both the economy and the healthcare system. But which side is getting it worse? Joining us to discuss is Director of the Fundraising and International Relations Department with Magen David Adom Emergency Services, Yonatan Yagodovsky, and ILTV contributor and consumer behavior expert, Dr. Vili Abraham. Gentlemen, thank you so much for being with us today. All right, now to begin, Israel's coronavirus infection rate is today sitting hardily at roughly 12%. The daily death toll per capita now even rising above that of the United States, leading Israeli leaders to talk about extending the punishing lockdowns with no details yet as of a way out. So, Yoni, I actually want to start with you. How bad is it? What is Israel's healthcare system facing right now?
We are facing a constant increase in the positively tested patients with COVID-19, and also, according to that, the people who are hospitalized, the numbers are also growing, especially the main concerns are the people are in serious condition or ventilated. That imposes also additional efforts on our behalf as Magen David Adom, and of course on all over the medical Israeli system.
Are we talking about a complete overwhelming of the healthcare system, though, or are we prepared?
It's not complete overwhelming. There are difficulties, but still the system is functioning, even though there are here and there some thoughts and remarks from the leaders of hospitals, etc., that if things will continue at this pace within the next few weeks, it might create a situation that will be much more difficult for the overall hospital system in Israel to cope with the growing numbers of specifically critical and ventilated patients.
I see. All right. Now, Vili, I want to turn to you for a moment, because meanwhile, with all the healthcare crises that are going on, with the public and the private sectors both essentially shut down for the time being, a record catastrophe is actually befalling the economy. Vili, can you lay down some of the hard numbers, like the unemployment rate, the national debt, things like that?
Yeah, well, if we're looking at the unemployment rate, it's currently 12%. So we have about 500,000 Israelis who are out of work. And the unemployment, unfortunately, is just going to increase as long as the lockdown continues in time. It's because a lot of business people understand that, for example, if you're in the restaurant business, it's really not as profitable to deal with takeaways. If we look at GDP, there is a serious contraction overall since the beginning of the pandemic. We're talking about a 29% decrease in GDP. That's very significant. But if you look at the second quarter in comparison to the first quarter, in comparison to some countries, we're worse off. For example, in comparison to Denmark, the contraction was 8.1%. However, if you look at countries like Sweden and Holland, it's better. The decrease in GDP was much more significant in those countries.
And what about issues within the public? For example, the homelessness rate or the new poor. How is this affecting the public?
Well, if we look at the future, or what is expected to happen in the future, there are several things that we have to look at. First of all, if you look at the way businesses are operating, they're operating in a very different form if you compare it to the pre-COVID-19 era. For example, a lot of businesses understood that they can serve the public, they can serve their customers with less employees. So it means that probably later on, many of the employees that were laid off will not be returned to their places of work. And according to one study in the United States, for example, one estimate projects that 40% of people who were laid off will never find a job again. So that's having very, very far-reaching consequences.
Where does that percentage come from? Is that from the older generation, in the workplace, or is that across age ranges?
It's really not clear. I assume that we're talking about the people who are less educated, the people who are unskilled laborers, and yes, the older population. Because one of the things that happens today is that A lot of companies are becoming digitized. And if you don't have the skills to work in a digital environment, if you don't have the skills to be able to work from home, if you look at the people who are working from home today, these are skilled workers. These are people from the financial industry, people who work in government offices, people who work at universities, and these are the people who work in supermarkets or cashiers, the less skilled employees. So I would assume it's among those specific populations, and that's a very significant number.
Yeah, well, all right. Well, speaking about some of the demographics in the populations, Yoni, I want to turn back to you. How many people have you treated over the holidays so far?
Well, during Yom Kippur, etc., we have provided medical treatment to more than 2,300 people with a variety of medical issues not connected to COVID.
Okay.
People who didn't feel well due to the fast, fainted, had chest pain. Of course, we had, especially from the young generation, kids that fell down when they were riding the bicycles and rollerblades in the streets and so on. The weather was relatively hot in Israel over Yom Kippur, so we were busy. At the same time, our blood services provided during the holiday blood units and plasma to the hospitals for further treatment of patients, including, of course, COVID patients that were treated with convalescent plasma. It was a busy weekend because, or holiday, because we also conducted in the Arab sector, especially in the Galilee, we continued to function our drive and test facilities for people to be tested where they are hopefully negative for COVID. And this service continued also over the holiday.
Well, so speaking specifically about COVID patients, what is the average demographic age of the patients that you're coming into contact with Magen David Adom? Well,
we are mainly transferring patients who are relatively elderly. We provide a special service with designated ambulances that we have built some physical separations in them and also different ventilation system that are taking positively tested patients from their homes to hospitals for further treatment, or from different medical facilities to rehabilitation centers, etc., and so forth. And that's a huge burden because, unfortunately, due to the certain times at the hospitals, especially biological ERs are overwhelmed, we have to transfer patients for a longer distance, not to their relatively local hospitals, and that creates another burden on our system. Another thing that we are meeting are the overall Israelis that have signs and symptoms, and they receive a referral from their physician to go and be tested. Either we come to them to do home testing, especially to people who are elderly or cannot travel for some reason, or too young to travel to the test and drive facilities, and then the entire age groups that are coming to our test and drive facilities. We also provide ongoing tests, daily tests to senior citizens' homes, to the residents, and also to the team that is treating them, which is part of the ongoing efforts of the Israeli medical system to make sure that the elderly people in our country are safe as much as possible, and to detect the option of an outbreak when you test routinely these people and make sure that once you have a positive patient in a certain location, the other measures are being taken by the system in order to control it much better and to try and prevent an outbreak within these ages.
All right. Well, so with the average age range of coronavirus still remaining arguably fairly high, Vili, I want to come to you on this. Do you think that the economy or healthcare bears more of a focus or deserves more of a focus right now?
Well, if you look at the economy, and I would like to answer your question and then ask Jonathan something, because if you look at the economic activity, just right after the restrictions following the first lockdown were eased, there was increased economic activity. Initially, a lot of people were scared to go to public places, but eventually you would see a lot of people going to malls and shopping centers, etc. As people started taking up loans. For example, in July, people took up loans totaling 6.5 billion shekels, and that's a very significant amount. But then when the lockdown was returned, or when we went into the second lockdown, activity came to a halt. And this has significant implications for both older populations, but especially for the Y generation. And I'll explain why. If you look at the Y generation, it's one of the generations that has the most significant financial problems in history. And the reason is because today, if you compare their salaries to the salaries of their parents, it's a lot less. If you compare the prices of apartments today, they are 10 times as much as the price that their parents paid in the past. And that's why if they lose their jobs, the dream of having an apartment is just getting farther and farther away. And I would like to ask Jonathan if the measures taken by the government, the restrictions, are really doing something to decrease the rate of infection, as opposed to just enforcing the need to social distance and to have your mask on all the time. Because these measures by the government, and by the way, one of I think the worst things is that if you take measures, that's fine, but you have to notify the public in advance, and you can't just change your mind or be in a state of indecision. If you remember before the second lockdown, there were a lot of restrictions that were published, but some of them we had to wait a couple of more days to know what the restrictions will be. So that's an interesting question, whether these restrictions are really helping to bring down the number of infections.
Jonathan?
Well, as you all know, these measures became essential, unfortunately, because as we saw during the first outbreak, we saw the numbers going down slowly and then more rapidly, and there was kind of a great feeling or almost euphoria that Israel is on the right track and so on. But then schools were open and businesses were open and life came back again. And then pretty soon after, within about 10 days to 2 weeks, we began to see the growing numbers. What we know now, and that the steps taken just a few days ago, we hope to see the fruits, the positive fruits, within, let's say, the end of this week, beginning of next week, because it takes time to try and balance. People that are getting affected begin to show signs and symptoms and be positively tested about 5 to 10 days after they were actually exposed to known patients. So we hope, everybody hopes, let's say, that the measures that we're taking now will show the positive outcome within the next week or so. At least now we know that the way that people behaved, let's say, in Rosh Hashanah, a week and a half ago, etc., doesn't look good. And prior to that, we can also see very clearly from the data that was accumulated by experts who work with the Ministry of Health, that the age group of, let's say, teenagers and high school kids contributed a lot to the patients or to the people that were tested positively. We also see a growing number, the age group of 20 to 29, also the age group in certain sectors of, let's say, 40 to 49, meaning people who are either studying or whether it's or trying to get a job and are part and that they're socializing, or people that are working and they have to go to work. And the outcome is that these growing tendency of positively tested patients within these age groups.
Well, so this actually leads me to my next question, because, if there have been a lot of people, I should say, who argue that by the end of this thing, everyone either has had it or will have it. What do you say to that allegation, that everyone in Israel will likely have it at some point before this pandemic is over?
Well, we all hope that there will be a vaccination relatively soon, and that people will be able to be vaccinated, and therefore will not be, let's say, exposed to the herd vaccination. When we look out to the world and to other countries, unfortunately, some of these countries, their death toll was extremely high. They tried not to close down and not to deal so much with restrictions, etc. It's a very tricky business. This virus and the effects of the virus and the side effects are not simple. We already know that there are prolonged effects on people that recovered in all age groups. We don't know how severe are they, how long will it take, will they sustain only several months or years in the future. There are a lot of unknown to the behavior of this virus and the side effects on people. So therefore, I believe and I hope that vaccinations will come prior to herd vaccination.
I see. Now, Vili, coming back to you for a moment, you mentioned earlier that the economy will likely suffer upwards of 550,000 unemployed by year's end. The government is actually estimating roughly the same thing at a roughly 13.6% unemployment rate. Is that the worst case scenario, or is that the best case scenario right now?
Well, it's really hard to say. It depends how things will develop. It also depends whether there will be a third lockdown, because as things stand right now, the gap between the rich and poor, which is very, very great here in Israel, will only decrease. If you look at what's going to happen with a lot of people who are going to, unfortunately, probably lose their homes, because if you remember, you were able to freeze your mortgage payments for 6 months, and it means that in October, all of those who froze their mortgages will not be able to continue to do so. And if they're out of work, probably, unfortunately, they will have to sell their apartments and move in with their parents or other family members. So if we have a third lockdown, it's going to have very, very far-reaching consequences, both socially and economically. And we should forget that, unfortunately, we're going to pay for the price dearly, whether it's the increase in VAT or income tax and fees that we'll be paying for government services, because the government will have to, fill up the government coffers somehow. So it will be both budget cuts and increasing of taxes, both direct and indirect.
So what do you see as costing us in terms of dollars and cents? What is costing Israel more? A healthcare system and lockdown, or the loss of workforce because of coronavirus, because of people maybe sick and permanently having to leave that workforce?
Yeah, well, that's an interesting question, which I hope Jonathan will be able to answer. But economically, it's really, really serious consequences. The mortgage industry is in shambles. A lot of confusion about what's going to happen, whether governments are going to be able to get back the loans that they've given out, and a lot of uncertainties. And we can tell, as if you look at the economy, that because people are not confident about their future, they're not sure whether they'll be able to hold on to their jobs, they're spending less. And as long as the unemployment continues, and it's likely to continue until the end of the year, I think that it will even continue well into 2021. Consumption will decrease. And even if people do get back to work, the question is, will they be hired full-time? And even if they are hired full-time, the question is whether they'll have enough disposable income to consume, because they'll have to be paying back mortgages, which will be more expensive if you freeze them. You have to return more. sometimes single-digit percentages or sometimes double-digit percentages more, and all sorts of loans that you're taking up to survive for this very, very difficult time. Very difficult time.
So then, Yoni, same question. Knowing what you know about the demographics and the areas in which coronavirus is spreading the most in Israel, can we afford to wait for a vaccine which may not come within a year?
It's a very tricky situation. I must say that the try to create a balance between health or maintaining health and securing health of people, and on the other hand, making sure that they can live properly and that the overall economy, the Israeli economy, will be able to move forward and develop itself, because it's clear, as mentioned and as known, that things are kind of a standstill and so on. It's a professional decision, I must say, that from people from the health sector, knowing the data, looking at the growing numbers and of people that are tested positive on a daily level, etc., the numbers are bad. I mean, it's really bad. We see a constant daily increase. More than give or take, about 8,000 people that are tested positive a day, which means that there are others who have not been tested, and they are, silent patients. They don't have symptoms, or they don't go to be tested, and that is a problem. On the other hand, having the economy or major places closed down and much less employment will have a huge economic impulse on everybody, on all of us.
All right. Well, gentlemen, thank you so much again for all of the insights that you've given us today. Unfortunately, though, that is all the time that we have today. Thank you, Vili Abraham and Yoni Yagodovsky, for joining us. And for all of you at home, tune in next time on Insider for more in-depth analysis on everything Israel. Also, if there's a topic that you want us to cover next, please let us know in the comment sections online. And finally, remember that for more news from Israel, follow ILTV on Facebook, like us on Instagram, and subscribe to our YouTube and Roku TV channels. I'm Aaron Porras. Thank you for watching.